All right. Thank you, Mr. Chairman. I'm sorry, Senator Thien, but I'm sure we'll get this straightened out. You know, when the coronavirus hit, nursing homes were ground zero. To date, at least
Get right.
130,000 nursing home residents and 1,600 staff members have died of COVID-19. Responding to coronavirus was challenging for every healthcare provider. Genesis Healthcare, a nursing home chain with over 350 facilities across the country, was one provider that struggled. Ms. Ramos, you work at Greenville Nursing Center, a Rhode Island nursing home owned by Genesis. From your testimony, it sounds like working at the facility last year was harrowing. So let me just ask, did you have the resources and the staff you needed to properly care for COVID-19 patients?
Thank you for your question. No, we didn't have enough resource or staff that we needed. But those, like I said before, aren't new issues. Sometimes we have two residents with serious need at the same time, but we have to choose who deserves our care, and every one of them deserve our care 100%. But it's sad that we've been put in that
Right.
situation all the
Well,
time.
and you're right, it is sad to be put in that situation. But basically, what you're saying is that you didn't have the supplies, you didn't have the staff you needed when the coronavirus hit. And I know that a lot of nursing homes around the country were in the same boat, which is why Congress passed COVID-19 relief packages like the CARES Act earlier to get providers the resources they need. Now, in January, I wrote to Genesis, which owns the nursing home where you work, and I received information that shows that they accepted $665 million in state and federal grants and loans last year. And guess what Genesis did? It gave its then CEO a $5.2 million retention bonus just a few months before he left the company, which was and is in dire financial condition. In total, the CEO, George Hager, received $8 million in compensation since January of 2020. Ms. Ramos, you told us about how one of your coworkers died while trying to care for COVID-19 patients while working at a facility with a $14 an hour starting wage. So let me just ask you your view on this. Should a top corporate executive have received a multi-million-dollar bonus while you were struggling to keep patients alive and keep yourself alive? Or let me ask it another way. What could have been done to improve patient care with that $5.2 million retention bonus that the CEO received?
No, I don't think they should make millions of dollars in bonuses. Because it's Medicare money, that money should be going to patient care. So with that $5 million that he received we could have put a higher wage so we could attract more staff to the field.
Right.
And
More staff, more PPE. And that's
yeah.
exactly what Genesis should have done. It should have invested in workers like you. So let me ask you, Dr. Gifford, you're here on behalf of the American Healthcare Association, which represents nursing homes. Do you think it's right that nursing home CEOs received multi-million-dollar bonuses while workers like Ms. Ramos fought for more PPE, more tests, and more resources? Dr. Gifford?
Senator, as a medical director, having worked in nursing homes in Rhode Island, I did not have the pleasure of working with Ms. Ramos there. I saw firsthand, as you've pointed out, and Ms. Ramos says, how hard the CNAs work relative to everyone else. And they are really the lifeblood of an organization. I think early on in this pandemic, there was not PPE worldwide anywhere. And we were hearing from every type of facility out there about the need for getting PPE. and getting staffing, and we were calling it. And what was available was not prioritized for nursing homes. It was going to hospitals and elsewhere. And I think the idea of how we prioritize and use that, the PRF funds that came to us were life-saving. Many of the nursing homes out there are small family-run nursing homes, second, third generation. And this
So
was really,
I'm sorry to interrupt, but let me just, that was not my question. My question was whether or not nursing home executives should be paid multi-million-dollar retention bonuses, or whether or not those millions of dollars should be invested in the resources that are needed to keep staff and residents safe and healthy.
I think it's a good question to think through how compensation is done at all levels, and how are we going to be able to compete for retaining and recruiting staff at all levels throughout there in the healthcare system. And that's something that we'll need to look at. And I think we are fully supportive of transparency regarding how these funds were used going forward.
Well, I appreciate that you're going to look at it, but I just want to be clear on this. We can't allow corporate greed to determine whether or not workers and seniors in this country live or die. And that's why I wrote to Genesis requesting information about their financial decisions. And today I'm going to release their response, which comes in the wake of reports that Genesis will soon be under private equity ownership. I'll be opening an investigation into for-profit nursing homes, including those run by private equity firms. And the next time there's a pandemic, seniors shouldn't be stuck in subpar institutions run by greedy CEOs and vulture firms in order to make a quick buck. Congress needs to act now before tragedy strikes again. Thank you. Thank you, Mr. Chairman.
Thank you.